I was introduced to homeopathy by my husband, who was a GP, and I was intrigued from the beginning, partly because I was studying for the membership of the Royal College of Physicians, which is a really tough exam in hospital medicine. And so in between revising, I would pick up my husband's textbooks on homeopathy. And what amazed me is that this data set existed that described human experience, not just in the way of physical suffering, but in the way of mental and emotional suffering as well. And I couldn't really get it out of my mind. So when the opportunity to train in homeopathy came up with the Homeopathic Physicians Teaching Group in Oxford, I started to train. At the same time, I was training in palliative care, cancer care, care of the dying. And I had a sense that I wanted to offer more to people. I wanted to offer more within the consultation, and palliative care had really been fantastic for me because I'd found a holistic approach that allowed me to sit with people for longer and where it was valued, this idea of listening. But then homeopathy took it a stage deeper. And not only was I able to listen, but I was able to recognize and accept a lot of what the patient felt had been quite important about their individual experience. So now I work as an NHS consultant, working in the Bristol Homeopathic Hospital, and I offer symptom control to cancer patients and also other patients across a wide range of conditions, along with children as well who might have difficulties. And for me, it's enhanced my working life in so many ways. I feel very connected to my patients. I feel very ready to listen. I feel very ready to be surprised by them telling me something I've never heard before. So a holistic consultation is always interesting, always new, and therefore offers me a lovely level of engagement and interest in my working life. Yes, it's important to have homeopathy within the NHS so that it broadens the choice for clinicians, but for patients as well, and also so that people can afford these kind of approaches that can be essential when you look at full recovery. Because sometimes a drug will do something important, but then there's the rest of the body that's trying to get well as well. I've used homeopathy a lot in the cancer setting, which is also my conventional training, and I've used it right across the range of dilemmas that people with cancer might experience. So we might use it up front at the point of diagnosis for shock or for difficult symptoms. We might use it to help the side effects of surgery or chemotherapy, and then we might use it for some of the longer-term effects, particularly some things like hot flushes, mood disturbance and fatigue, which women with breast cancer on anti-estrogen medication can experience. So we get a lot of referrals directly from the oncologists, from the breast care nurses, knowing that we can really offer them an opportunity to help these women who are a bit stuck. They can't take hormone replacement therapy, they don't want to take antidepressants, these might be other conventional medicines indicated, so they get referred along to us and they're seen within an hour. We build a profile of them as an individual, and say, like from my clinic yesterday, 2 women greatly improved in their hot flushes, fatigue, mood disturbance, 70 to 80% better within a couple of weeks of taking a homeopathic medicine. I might also see people with autoimmune disease like Crohn's disease or ulcerative colitis or multiple sclerosis, all of which have a symptom burden that can really impact on people's quality of life. So although they may have needed conventional drugs and treatments, there's often other symptoms now that need treating. And again, because homeopathy is a whole body approach, a whole system approach, then often people can feel better in themselves, in their well-being. Like the lady yesterday said, I feel completely different in myself, better in my whole self, which is fantastic when you think that was just at her first follow-up.